Hi everyone. We are on Morjim beach. We are here for Dr. Subodh Kerkar's beach installation, and we are all part of this Goa University program where we learn about contemporary art. And one of the another participant with us is a very prominent eye doctor, Mr. Dinesh Verma. So I thought of just having his interview and talking with him about what brings him here, sir. What brings you here in Goa?
Oh, lot of things.
Yeah.
So when I was a teenager in growing up in Delhi, I was born and brought up in Delhi, and always wanted to come to Goa, but I could not afford it. I'm from a very humble family, and my father could not afford holidays like that, and most of my friends used to come here. And then we had the movie Bobby, which made Goa as the heaven for youngsters. First time I got the chance to come to Goa was in 2012.
Okay, much later.
Much later.
Then when
And
Bobby came, after that Dil Chahta Hai came, and a lot of other
exactly,
movies
all
also.
other movies which I used to watch, and then when I came, I fell in love. It was better than I expected.
Yeah.
So at that time, I decided I'm going to stay here and spend as much time as I can. Mostly the winters, but I think it can be extended now that I know Goa better because it's beautiful in rains as well.
Yes.
The reason I'm here today, as you said, is because of Dr. Subodh Kerkar. I have interest in art myself. I've been dabbling with it since I was a teenager. I've done some courses, 1 year course at the Triveni Kala Sangam in Delhi. But then you become a doctor and you spend all your time with your patients and everything else. And it's only after I took sort of semi-retirement and not do active surgical practice that I've gone back. Now I'm doing oils, acrylics, and sketching has been my passion. So I'm learning about art, I'm learning.
So this has been the fifth day of our workshop since we began in university. Today has been a long day. We spent a lot of time in Museum of Goa. Now we have come here. So how was the experience so far of the entire course?
It's been amazing. It's
Yeah.
been amazing. Not only learning about art, but learning about the journey. I think that was the best part because Dr. Kerkar has been sort
Okay.
of
Okay. I think we need to take a little pause. He's calling us.
Children run. When they're happy, they become birds. So they run like this.
Yeah.
If a 65 years old can do it, you can do it. So this and this. This and this. This. Yeah.
I'll stay in the end. The slowest. I'll stay in the end. No. 66, 65 to 66. We are landing.
Okay. Fun.
Okay. So last time we were there, we just had to interrupt because Dr. Subodh Kerkar called us for being part of the beach installation. You just was part of it. How did you feel?
It was amazing, absolutely amazing experience.
Ah.
So I felt like I'm that 6-year-old boy again. Running around, flying, thinking I'm a bird. It was absolutely fantastic.
So we'll try to put those visuals in as part of this video.
Mm-hmm.
So while continuing our conversation, we were discussing how the course has been since last 5 days for you.
Course has been very different from what I've done before because
Okay.
most of the art courses that you go to, they start teaching you, how to do either sketching or painting or what colors to use
Yeah.
or what. While this course was more about journey, and that also from a doctor, which had special sort of significance for me. A journey of a person who is an academic, who is a practicing doctor, going into art and how he changed his vision of art, understanding of art, and that helped me to understand the art much more. So I've enjoyed the course very much, and every day it was a different topic, including things like happiness.
So we often have this thing when you are part of a particular field. you want to learn more and more about that field. But what when you have to go take a different path, like you have done yourself? Like for our workshop itself, there are people from different backgrounds who have joining this, who have not originally not coming from the art background, but someone who have the yearning to learn about art. How this helps you in your own field, in your overall perspective about your life?
I think it's a great help. First of all, it opens up your mind to new possibilities, and it sort of starts to induce the creative juices inside you. And I've always been a kind of person who would learn anything that I can. And there's a very interesting episode in my life when I was operating on hundreds of patients on a very high volume duty, and I met a guy who said, "Would you like to come and give an interview on the radio station about eye problems?" So I said, "Fine." So he was running a local radio station. This is in UK, in Southampton. So I went. The interview went very well for 2 hours, and after that he tells me, "Would you like to be a DJ?" I said, "What?" He says, "Yeah, RJ, radio DJ." I said, "You must be joking. I'm a 45-year-old ophthalmologist, eye surgeon." He says, "No, but your voice is very good for the radio."
Yes, it is.
So I said, "What is the deal?" He said, "The deal is I will give you free training for 80 hours, and I will teach you everything about radio, everything about being on air, and including all the
Keyboard,
controls and
yeah.
keyboard and everything that you have to manage two computers at the same time. But in return, you have to be volunteering for my radio station for a year."
Okay.
I said, "Brilliant." And I loved it. And he gave me a full collection of the songs. So this was the 1970s and 80s songs that I specialized in, Bollywood songs. This was
Which songs would you play often if you remember?
Things like Silsila, मैं और मेरी तन्हाई अक्सर ये बातें करते हैं, तुम होती तो ऐसा होता, तुम होती तो वैसा होता. That's one of my favorite songs. And that era, all of that era, coming from the songs from Guide, and I used to do a storyline. So we take one character either as a actor or a director or a music director, and then just talk about them in the whole thing. So after 1 year, my contract there in Southampton had finished, and I said, "Thank you very much, it was great." He said, No, you can't go." I said, "What do you mean you can't go?" My job is here gone, and the deal was for 1 year. He says, No, but my ads are coming because of your program. Because the older age group are all listening to 70s and 80s. So he ended up giving me a radio station, a portable system which I could connect to the internet, and I was actually doing that.
Beautiful. So coming back to your field itself, you can tell us. Now you said you have retired almost. You're not practicing. You're not practicing.
I don't like the word retired.
Yeah.
So I'm not doing active surgery at the moment.
Okay.
But I'm consulting in the field, and also in something that I have a special interest in. Technology has always been my passion.
Yeah.
So I'm consulting with companies that are developing artificial intelligence for medicine, and also I have degrees in medical ethics and law. So I give them advice about how to make ethical products which fit with the regulations, and they should not go against the law of the land.
Can you highlight some of the major concerns when you combine artificial intelligence and medicine?
So artificial intelligence is a great thing because it also has machine learning, as you know, part of it. So not only that you put in lots of data about the patients, that they come with symptoms, that they have investigations, but the machine also learns. So the amount of analysis that they can do through the algorithms is unbelievably complex, and yet it looks so simple, especially now with the LLM, the large language models as they call, because you just talk to the computer. The problem comes with the ethics and also accountability. Supposing the AI makes a wrong diagnosis, who is responsible?
Yes.
Is the doctor who is taking the advice, does he make a decision? So what we now say is, do not make the AI as the diagnostic tool. It is only a co-pilot.
Okay.
So the doctor still remains a pilot who is driving in the driving seat, and the AI systems are only helping the doctor to
So
make
it
the
will
right.
present you with multiple options. Then the
Absolutely.
doctor's own analysis of a patient, of his own experience, everything comes handy, and then you decide.
Absolutely. That is very, very important, because A, the doctors should not feel threatened.
Yeah.
They should feel as if this is to help them. And B, that it should not be taking over from the doctors.
Absolutely.
Because there is a sort of fear amongst the medical profession that
In every field, I think
in
there
every
is.
field,
Yes.
in every field, absolutely. So as Novel Harari said, it's AI is going to take over everything. There will be no jobs, but you have to learn new things so that you can be in control and you can continue to be telling what to do.
You also mentioned that you have done some ethical law with regards to this aspect of artificial intelligence in medical. So where does law fit? What are some of the provisions, international standards which are coming up now or may should come according to you?
So at the moment, it's a very nascent field. It's very, very new, and people are all learning. Medical ethics and law in itself is a wide speciality, but putting AI into it is something new. So we are trying to fit into that. So we already have laws about data protection. We already have laws about privacy. We
Yeah.
already have laws about, how to ensure that nobody breaks into the system to do things which can affect the patient's health. So one example in the previous years was pacemaker. Now the pacemakers are the ones which will make your heart tick. So it is changing your heartbeat, and they can be controlled remotely.
Yeah.
And you can imagine that if somebody can hack into the system, it'll be so easy to murder somebody.
Yeah.
So that's where the law comes in, that you have to ensure that no illegal activity can be done through that. So same way when we use artificial intelligence in medicine, we have to ensure that we are following the regulations. Recently, WHO has passed quite a few strict regulations of how to use AI in medicine, and Europe is setting up the agenda. UK is one of the top countries which is doing that.
So a lot of these technologies are unheard of, they are disruptive, they suddenly emerge. So should the law come first or should the technology comes first?
So that's a very good question. I think it's always the technology comes first and the laws follow.
Yes.
Because you can't have the laws. And when you say it bursts into, suddenly bursts, it's not true. It's not actually sudden. Because if you look at AI was initiated in year 1956. So it's been developing, and it's been all around us for the last 10, 15
Especially
years.
science fiction, we've always heard of those
Science
things.
fiction we've always heard, but even in day-to-day use, we've been using things like Amazon, Zomato, and this is all AI.
Yes.
They were all using AI. So it's not that AI has come up. The only thing which came up in the last year is the large language model, which is just like you're talking to me, I can talk to the computer.
I think ChatGPT.
ChatGPT
Last time around last December, 15th or 5th of December.
Yes.
That is what actually changed the world.
Exactly. So suddenly people realize, oh my God, it is so human. Because before that you had to type in, or you are, putting in Google search. Google search is AI.
Yeah.
But it is not that AI that you can just speak and it comes up with a language that everybody understands. So that is the best part.
So I have a very different question. I don't know whether it's a good question, but I am a part of a law college, and you are saying there is a lot of development that happens within the medical field with regards to AI. Can there be a student with a focus that I want to look at this field? Can a non-medicine person be there in this
Absolutely.
field as an
In fact,
expert?
This is something that I want to encourage in India, because abroad, especially in US, the system of having two specialities is very common, and that is the key to innovation. So I was telling you some time before about the person who wanted to be a ophthalmologist to create a retinal chip implant,
Yes.
but he had to do engineering, and he did it,
Yeah.
which is not coming to India as quickly as it should. So same way, there should be a person who is interested in law and medical ethics should be able to, or ethics as such, should be able to specialize in the field of medical ethics.
We in fact get a lot of students who have done their medical degree and then they come and
They
join
come and
LLB.
join LLB, yes.
So I think that kind of approach would help,
Absolutely.
and it's like an emerging field, like you were saying.
I have actually been approached by one of the law colleges in South Goa
Okay.
to be on the faculty, but at the moment they're struggling with students.
Yeah.
They don't have enough students. So if your university wants, I can come and give some inspirational lectures to them.
Definitely.
But that is the way to go. I think,
Yes.
you know, people should know about more than one field.
Mm.
And that cross pollination, as it is called,
Mm.
that gives the maximum benefit to society.
Okay. Thank you so much, sir.
You're welcome.
It's been a pleasure talking
Thank
to
you.
you and knowing such a lot of things from you.
Thank
yes.
you very
Thank you
much.
so much.
Thank you for having me.
Yes.